So we are talking about ear reconstruction surgery today. It is one of the surgery which I feel so passionate about. A lot of children are born without any ear, external ear, or they may be having very rudimentary skin tags. This is called as anotia or microtia, depending upon what grade it is for. And the surgery is called as ear reconstruction surgery. Similarly, many adults may also lose ears due to any trauma, accident or burns, and they may have no external ear. Now, ear is very important for not only for aesthetic reasons, but also to wear spectacles. It has to rest the external ear. And there is also an auditory meatus which takes the noise from outside to the eardrum and inside cochlea so that the person can hear or listen. So ear is very important, external ear. And the surgery is done by harvesting the rib cartilage of that own individual and carving out an ear. So this is a very difficult surgery done by very few people across the globe. What surgeons do is, we make an incision on the chest, take out a portion of cartilage, and out of those cartilage, the ear is carved out. And this new ear framework, cartilage framework, is put inside the position where your normal ear should have been. And then the whole framework and skin is lifted up or elevated so that you get a near normal ear.